Welcome to the Family Residential Care Home, a place where the quality of care matters. In the heart of our operations is our CEO and administrator, Michael A. Walters, MBA, a visionary leader who believes in the power of knowledge for delivering outstanding care to our residents. Under his guidance, we've designed a unique training program for our team members. This program is not just about learning, it's about understanding and providing the best care possible to all the residents here at the Family Residential Care Home. Today, we're embarking on a journey to explore an often misunderstood health condition, hypoglycemia. So, buckle up as we dive deep into the world of healthcare, enhance our understanding, and make a significant difference in the lives of those we serve. We would like to take a moment to appreciate our dedicated staff. Thank you for your time, effort, and the incredible work you do here at the Family Residential Care Home. Your hard work and commitment do not go unnoticed. Michael A. Walters, MBA, thanks each one of you for making this place where the quality of care matters. Are you ready to get started? Just a heads up to help reinforce the information learned today, there will be a written test following the presentation. Study well and good luck. Keep in mind this written test is a crucial part of our learning process and is designed to reinforce the information you've learned today, so make sure you're ready. In our everyday lives, we often overlook the subtle signals our bodies send us. We dismiss them as unimportant, or chalk them up to stress, fatigue, or just a bad day. But what if these overlooked signals were our body's way of alerting us to an invisible threat? A threat that, if left unchecked, could lead to serious health issues. Welcome to our video guide where we will shed light on one such invisible threat, hypoglycemia. By the end of this video, you'll not only understand what hypoglycemia is, but also be able to recognize its early signs and understand the importance of early detection. So, sit back, pay attention, and let's embark on this journey of awareness and empowerment together. Imagine you're enjoying a casual day out, when suddenly you feel dizzy and disoriented. You can't understand why you're sweating profusely, your heart is racing, and you feel an insatiable hunger. What you're experiencing might not just be a random incident, but a sign of hypoglycemia, a silent health condition that could be lurking in the shadows. With this video, we aim to empower you with knowledge about this often overlooked health issue. So let's dive in, understand hypoglycemia better, and learn how to spot its early signs. Remember, knowledge is power, and in this case, it could be the key to maintaining your health and well-being. Ever wondered what hypoglycemia is and how it affects your body? Today we delve into this intriguing subject, shedding light on the early symptoms and providing you with knowledge that could be vital for your health. Hypoglycemia, also known as low blood sugar, is a condition that can sneak up on you, often without warning. It occurs when the level of glucose in your blood drops below normal, creating a host of symptoms that can range from mild to severe. But what are these early symptoms of hypoglycemia? Well, the first signs can be subtle and easily mistaken for other issues. You might feel a sudden onset of hunger, even if you've just eaten. This hunger can be accompanied by weakness or fatigue, a general feeling of being worn out despite having had ample rest. Another common symptom is a feeling of nervousness or anxiety. You might feel unusually jittery or shaky, and these feelings can be accompanied by a rapid or irregular heartbeat. Some people also experience a tingling sensation in their fingers, lips, or tongue. As the condition progresses, you might also notice changes in your mental function. You may find it hard to concentrate or become unusually forgetful. Some people also report feeling dizzy, lightheaded, or even a sudden onset of clumsiness. One of the most common symptoms is sweating, even if the temperature is cool or you haven't been exerting yourself. This is often one of the first signs that something is amiss, and it's a symptom that should not be ignored. In summary, hypoglycemia is a condition where the glucose levels in your blood drop too low, leading to a range of symptoms that can affect both your physical and mental health. The early signs are often subtle, including sudden hunger, weakness, nervousness, rapid heartbeat, tingling sensations, difficulty concentrating, forgetfulness, dizziness, and sweating. Recognizing these symptoms early is crucial. It allows you to take action promptly, to restore your blood sugar levels to normal and to avoid further complications. Hypoglycemia might be a stealthy condition, but with the right knowledge, you can spot it before it takes hold. Remember, your health is in your hands. Understanding the symptoms of hypoglycemia is a step towards maintaining your well-being and ensuring you're always at your best. After all, knowledge is power, and today you've added a vital piece of information to your health arsenal. Stay informed, stay healthy. Now, we've embarked on the comprehensive journey of understanding hypoglycemia, its symptoms, and the criticality of early recognition. Interestingly, both hypoglycemia and hyperglycemia, which is high blood sugar, share similar symptoms. These symptoms include vision changes, fatigue, and hunger. However, the key to tackling both lies in identification and timely action. If a person is showing signs of either high or low blood sugar, the first course of action should be to take their blood sugar. Now, how well have we absorbed this information? To ensure this knowledge is firmly ingrained, we're introducing a written test that will follow this presentation. This test isn't a dreaded school exam, rather a friendly tool to reinforce what we've learned and to help us remember it better. We encourage you to review the material and prepare for this test. It's not about passing or failing, but about ensuring you have a solid grasp of hypoglycemia, hyperglycemia, their shared symptoms, and the imperative initial step of blood sugar testing. So let's gear up and get ready to put our knowledge into practice. After all, true understanding comes from applying what we've learned. Remember, this is not just for you, but for the well-being of those around you who might be silently battling these invisible threats. In our last segment, we introduced a test to reinforce our understanding of hypoglycemia and hyperglycemia. Now let's dive deeper into the practical aspects of managing these conditions. We'll discuss the 5 R's of giving medications: right patient, right medication, right dose, right route, and right time, plus the additional R, right documentation. Recognizing the signs of low and high blood sugar is crucial. Low blood sugar symptoms include hunger, sweating, and dizziness. High blood sugar symptoms include extreme thirst, increased urination, and sweating. If a patient shows any of these signs, make sure to test their blood sugar immediately. Remember, medication must never be transferred from the original container it was released in from the pharmacy. If a resident refuses to take medication, it must be documented on the back of the MAR. When giving PRN medications, you must sign the front of the MAR and the reverse side, stating the date, time, medication, and reason for giving. Never administer a drug that has changed in shape, size, or color without verifying with the doctor. Always recap a needle before placing it in the sharps container. If a doctor's order states that a patient is to receive 22 units of insulin, you must dial 22 units on the Innolet device. Remember, insulin must be kept in the refrigerator. Additionally, when administering eye or ear drops, allow 45 to 60 seconds between drops. If 2 different types of inhalers are being used, a gap of 5 minutes should be maintained. To correctly administer an inhaler, follow these steps. Shake the inhaler, place it in the patient's mouth. Tell the patient to breathe out and get ready to breathe in. Press down on the inhaler to release the medication and ask the patient to tilt their head back. Understanding and applying these practices will ensure better management of hypoglycemia and hyperglycemia. Remember, knowledge is power, but only when it's put into practice. Before we conclude, we want to take a moment to extend our heartfelt gratitude to all the diligent staff members here at the Family Residential Care Home. Your dedication, hard work, and commitment to providing the best care possible does not go unnoticed. Each day, you exhibit the true meaning of our motto, where the quality of care matters. Your efforts to learn more about hypoglycemia and hyperglycemia management, and your consistent application of the knowledge gained is commendable. We encourage you to continue this journey of learning, to keep asking questions, and to always strive for excellence in the care you provide. Remember, every small action you take contributes to the overall well-being of our residents. On behalf of the management team, I, Michael A. Walters, MBA CEO, want to say a big thank you. Keep up the good work, and together let's continue to make a difference in the lives of our residents. All right, everyone. Now that we've covered a lot of ground on hypoglycemia, it's time to put your knowledge to the test. These questions are designed to help you reflect on what you've learned and to reinforce your understanding. Question 1. Multiple choice. Choose the correct answer. Question 2. Can you list the 5 R's in administering medications? Question 3. Can you identify the signs of low blood sugar? Question 4. How about the signs of high blood sugar? Question 5. If a patient is showing signs of high or low blood sugar, do you test their blood sugar first or immediately? Question 6. True or false? Medication cannot be transferred from the original container that it was released in from the pharmacy. Question 7. If a resident refuses to take medication, where must you document it? Question 8. When giving PRN medications, Where must you sign and what information must be provided? Question 9. If a drug has changed in shape, size, or color, what should you do? Question 10. True or false, you must recap a needle before placing it in the sharps container. Question 11. If the MD order states that a patient is to receive 22 units of insulin, how much should you dial on the inhaler device? Question 12. True or false? On the inhaler device, you can dial forward and backwards the amounts of units you need. Question 13. Where should insulin be stored? Question 14. How much time should you allow between drops of eye drops or ear drops? Question 15. How much time needs to pass between uses when two different kinds of inhalers are being used? Question 16. Can you list the correct order when giving an inhaler? Remember, knowledge is power, but only when it's put into practice. We encourage you to review these questions and your answers to ensure you're comfortable with the material. Thank you for your dedication to providing the best care possible.